we invited Dr. Lucky Sekhon to answer all of our fertility questions. She's a board-certified reproductive endocrinologist and infertility specialist at RMA of New York. So good to see you.
Thank you for having me.
Oh my gosh, thank you for being here. Listen, I went through this firsthand, and I did this a couple years ago. I felt like I had waited too long. When is the best time to start talking about your fertility and thinking about IVF?
I actually think that it's never too early. For a lot of the women that I see and treat, the last time they thought about reproduction was in health class, where the goal is the opposite. It's to avoid getting pregnant. And then people are just counting on stumbling upon the right information at the right time, and not everyone is getting that same education that you were referring to earlier.
Yeah.
So I think that in your 20s, especially your early 30s, it's time to start thinking about your priorities. Are you someone that wants to have children? Is that something you envision for yourself? You don't have to know all the answers. Are you someone that isn't ready right now, but maybe you want to explore and understand a little bit more about things like egg freezing to be proactive? I do think that this should be at the forefront of everyone's mind because fertility is so time sensitive.
I mean, we know that it's not in the forefront necessarily because Heather was even talking about the response to when she spoke about this in her comedy special was overwhelming.
Right.
So many people feel alone. And I wonder why we're not having these conversations about women's health in a broader way. Do you?
There's so much stigma and fear and shame associated with infertility or the fear of infertility because people feel like they've failed or their body is not doing what it's supposed to be doing. Or often, you know, the first thing patients ask me when a cycle doesn't go the way we want it to is it something I ate or I didn't eat or something I was too stressed out?
Yeah.
And
like
really
blaming themselves.
Correct. And
You go through everything in your head. You're like, I'm a healthy person.
Yeah.
How am I not able to have a healthy egg supply? Or why isn't this working?
Right. Infertility is so prevalent, and it is something that has increased over time because a lot of us are waiting till we're in our mid to late 30s, and our biology, our evolution hasn't caught up, right?
Yeah.
And I think the concept of trying to have it all is a great one, but sometimes we have to prioritize and be strategic, and that's where being proactive and thinking about things like egg freezing or embryo freezing comes into play.
Yeah.
I did this to be proactive, and then I was shocked that I should have done it sooner. But what would you say to people right now who are actively trying to get pregnant? When should they reach out to a specialist? How long should they wait if in their trying process?
Well, I think we need to normalize the idea that human reproduction is inefficient, right? In someone's 20s, when they're thought to be the most fertile they're ever going to be, they're ovulating one egg every month and timing everything. And there's probably a 20% chance that that could result in pregnancy. And that drops to about 10% per cycle when you're in your mid to late 30s. And so it is normal for it to take time and persistence, right? And if you're under 35, maybe you take up to a year to try on your own. If you're over 35, because of the age-related decrease in our egg quantity and quality, you should see a doctor sooner. And if you're in your 40s and you're navigating this, don't wait longer than 3 months. And if you're someone who doesn't ever get a period, I always say when it comes to trying to get pregnant, if you're not ovulating, you're not in the game, and you need to see someone right away.
Okay. You know, I think one of the things that Heather said, which is so true, is like, why didn't anybody tell me? And I feel like this is a conversation that mothers can be having with their children.
Absolutely.
About, you know, young women who are thinking about having it all.
Yes.
You know, her career was taking off.
Yeah.
And so that was the priority, which it should be.
Right.
The cost is expensive.
Yes.
When we think about cost, are there any advancements with that? Will work pay? Like, how can we
We're
talk about that?
seeing major strides in the last decade. I know that a decade ago where I work, 0% of fertility preservation was covered by insurance, and now it's almost half of cycles. We still have a long way to go. I'd say there's 14 states that have some sort of state mandate where insurance companies have to provide some sort of coverage for IVF. And a lot of employers are providing this benefit, which is wonderful. So we're seeing a lot of improvement, but we need to keep going so that everyone can have access.
And if you're going through IVF right now, is there anything naturally you can do to boost your results, if you will?
Yeah, definitely. I think the first thing is being really vigilant, tracking your cycle. A lot of times women are over normalizing their pain or the things that they're suffering with their period. But if you have heavy, painful, or irregular periods, talk to your doctor and do so early. Being the healthiest version of yourself, right? Trying to eat healthy, trying to be active and maintain a healthy weight as much as you possibly can, controlling any chronic medical conditions, avoiding things like smoking and even vaping, because we know that's never good for fertility, and even minimizing alcohol. I always tell my patients definitely less than 4 drinks a week. Try to minimize it as much as you can.
Okay, well, thank you so much, Doctor.
Seriously.
That was really great.